When patients come to the clinic, there's no specific procedure that needs to be done before they have the treatment. So the patients can come in as they would for any other procedure and get the treatment done within the time limit that is allocated to them. There are no absolute contraindications except for any severe disease such as immunological reactions, lupus, or any disease that has to do with oncology. It is better to stay away from these procedures when patients are severely ill. You also have to make sure for patients who are under anticoagulant treatment, patients should know that they could have some bruising. Other than that, there's no specific contraindications to this treatment. Throughout these many years that we have had CoolSculpting for the treatment of unwanted fat, there have been several cases, few around the world, that have been reported in what is called a paradoxical reaction with an increased amount of fat where this problem has been treated. It should be noted that these patients are few and far between, and since the new arrival of the updated version of the CoolSculpting machine, which is called the Cool Advantage, these cases have been severely reduced. When patients leave the clinic, they basically have no real visible signs of treatment. The only thing that can happen within 24 to 48 hours post-procedure is a slight swelling in the area that they have been treated. This is due to the inflammatory reaction that happens after the destruction of the fat cells. The indicated areas for treatment with CoolSculpting are lower and upper abdomen, flanks, butterfly wings or bra wings, outer thighs, inner thighs, underarms, and submental fat. What is interesting with cryolipolysis is that we are born with a certain amount of adipocytes or fat cells, and these numbers don't go up throughout our life. What happens is an expansion of the fat cells throughout our life if we gain weight. So when we create a cryolipolysis with CoolSculpting, the number of fat cells is destroyed. We have seen quite clearly that if patients stay at a stable weight and do not gain weight throughout the time period, the fat that is destroyed remains that way long term. We have studies that now show 9-year post-treatment with patients who have stayed in the same weight profile, and there has been no appearance of fat deposits where the patients were treated previously. So it's important to give the information to the patient that as long as they stay stable with their weight, the fat that is destroyed will remain like this forever.